Hi everyone, my name is Mike Haggerty, and I did my project on Blepharospasms. So, what is a blepharospasm? Well, it's an abnormal, involuntary blinking or spasm of the eyelid. This could also be shown as an irritation or inflammation of the eyelid. When the eyelid is inflamed or irritated, you see the eyelid start to close very closely and you barely could see the eyeball. It's a type of dystonia, and it originates in the motor nerves of the brain. So what are the major causes? Well, the main reason for involuntary blinking has to do with the basal ganglia. And we know that the basal ganglia controls all the muscles in our body. And when we see this spasm, the basal ganglia shows abnormal functioning. And we all know that the basal ganglia controls all the voluntary movements, learning, and eye movements, and cognition. So that is being affected. When this is being affected, the optic nerve will have trouble transferring the visual information to the basal ganglia. It may appear as a basic eyelid twitch, but can deteriorate if left unattended, and can cause blindness. Both eyes will be involved in it, and the spasms will last a longer time. So the symptoms. There are no main warning symptoms. It kind of just comes in as it pleases in a way, even though it's not very pleasing. We see increased blinking. We see great eye irritation. We see a lot of fatigue around the eyes, especially the muscles around there. When the muscles are very fatigued, we are producing a lot of lactic acid, and basically the eyes are closing and trying to stay open, but really can't. And we see a lot of emotional tension, and into bright light, it's very sensitive. And it could lead to other facial spasms around the cheek, around the chin, and around the nose. We also see involuntary closure of eyelids, which is the main common twitching that is occurring. And then the last thing we see is inflamed enclosure of eyelids. See, as you look at the guy in the picture, you see around his eyes it's very inflamed and irritated, and you can barely see his eyes, and it's just not a pleasant sight, and the guy is really suffering from inflammation. So there is no successful cure to this treatment, but they have a couple things that have been helping people. The first one is the injection of the oculinum into the muscle eyelid. Basically, as seen in the picture to the left, we look at this person in the picture. An injection with a needle is placed into the muscle around the eyelid, which basically is trying to help from the inflammation and irritation and try and stop the twitching around the eye. And we could also do a myectomy, which is a surgery that's actually taking some of the muscles out of the eye. And looking at information from research, it showed that about 75 to 85% was recovered around the eye in people, but not a full 100%. So that's why it's not a successful cure, but it does help with the inflammation, irritation, and the twitching. We also see that another great way to get help is therapeutic needs, whether it be acupuncture, chiropractic therapy, and even nutritional advances for specifically this, which will help. We also see that we could have coping mechanisms, maybe examples specifically like putting your two thumbs around your eye in a specific area to try and help with the twitching, wearing a baseball cap so it tightens around so we'd have less twitching. And we see many other examples of maybe sitting in the dark light, putting your head back and keeping your eyes forward closed. Many examples like that, just trying to help with the twitching that is occurring. And also muscle relaxing medication can be used. And I just had a couple facts about it. It actually affects more women than men. The average age of onset is 56, and approximately 2,000 individuals are diagnosed each year, which I thought was very interesting. I mean, it doesn't look a lot, but imagine getting this type of spasm continuously. It could cause a lot of pain, and there's 5 per 100,000 individuals that usually get it.